Marina, you're evaluating.
Oh,
Okay, the objectives are select the right words in sentence structure to communicate your ideas clearly, accurately, and vividly. Use rhetorical devices to enhance and emphasize ideas. Eliminate jargon and unnecessary words. Use correct grammar. And the timing is 5 to 7 minutes.
Thank you. Good evening, everybody.
Good evening.
As Dr. Cohn said, I am a physician assistant, hence the get-up for this evening. Getting the most from your medical visit. Recently, I had a patient come into my office. We spent about 20 minutes together. As a PA, I'm very lucky that I get to spend a lot of time with my patients. And after he left, the front desk called me and said, you know, Mr. Jones needs to ask you something else. So I said, okay, send him back. He said, you know, there's another thing I meant to ask you. He asked me that question. He left. And a couple of minutes later, the front desk called me and said, Mr. Jones again. He has something else he has to ask you. It's like, fine, send him back. So many of you may have heard of something called white coat hypertension. I call that white coat amnesia. The minute people walk into my office, they forget everything that they wanted to ask me that they knew they would get taken care of in their 20 minutes. So come to your medical visit prepared. That was the reason for the books this evening. Get a notebook. Keep records of your important medical events. You'd be surprised how easy it is to forget when something happened, when you've had your tonsils out, when you had chicken pox, when anything could have happened. Keep a list of all of your medications. Many medications sound the same, and they can be for completely different things. Perfect example is something called Lexiva and something called Levitra. Lexiva is an HIV med. Levitra is for erectile dysfunction. So you really don't want to get those confused. And they sound very much alike. Keep a list of your allergies. This is essential. People come into me all the time and say, I was allergic to some antibiotic. There are hundreds of antibiotics. Being allergic to some antibiotic doesn't give me any indication of what not to treat you with. So this is a very, very important piece of information. Know your family history. No, I find that women are very good about knowing family history and men are less good about it. And I don't know what that says about us in the way we are raised and the way we raise our kids. But knowing your family history is important. I happen to have a family where I would say 95% of the people in my mother's family had cancer and eventually died from it. That's an important piece of information to have when you go to the doctor, because you may be more vigilant about doing things like screening colonoscopies or mammographies, where somebody else who doesn't have that history wouldn't be so important to them. I recently had dinner with my first cousin, and we got into the topic. We're both kind of getting older. I'm the oldest in that part of the family, and I said to him, you know, what do you know about our family? He said, nothing. Do you have any idea what any of the relatives had? Not a thing. It's like, so Jason, it's really important that you know this because this could impact your life. It's your genetics. So that's an important thing to know. Know what your normals are. Know your normal blood pressure. Why is that important? If your blood pressure is always 110/60, and you for some reason go to the doctor, you're not feeling well, you go to the emergency room, and they take your blood pressure and it's 200/100, that's a huge important difference. Rather than if you're somebody whose blood pressure is usually 190/90, and you go in and you have that other high blood pressure, that's not as big of a difference. So knowing your normal is a really important thing. Knowing your cholesterol and all of the other lipids, all of the other fats in your blood is important as well. Just having your provider say to you, your numbers are great, isn't great. You should know where your numbers are. And if you make changes in your life, you should want to know what those changes reflect in your blood work. You give up McDonald's, and you go back and your doctor says, or your medical provider says, well, there's been a big improvement. That's nice. What was the improvement? Let me know my numbers. And keep a record of those things. Knowing your glucose levels. Now for people who are diabetic, they're used to doing finger sticks. But understanding what that means and what it means for 2 hours after you eat that your sugar hasn't gone back down to normal is an important piece of information that you have. And your time with your medical provider is the time to get that kind of information. Plan ahead. So many people come in to see me because they have a medical concern they really want to talk about. And a lot of times I take over the conversation. Go figure. That happens. When you go in for, let's say you have a new fever or a cold, these are the things that your provider wants to know. When did your symptoms start? How long have you had it? Did you wake up with it this morning, or have you been dealing with something for a while? What seems to make it worse or make it better? If people come in and have belly pain, and it's always worse after they have a bacon cheeseburger, that's an important thing to know, all right? That could be a gallbladder problem. Rather than every time I have ice cream, I have to run to the bathroom. That's a completely different issue. So knowing what makes it better or worse is an important thing to take note of. Have you done anything yourself to make yourself feel better? You know, I've had a cold for a week. I went and got some Sudafed. It didn't help. I got that Tylenol, cold and flu. It didn't help. Your provider wants to know what else you've done. Have you ever had these symptoms before? I have this splitting headache. I've had it for a week. I want to sit in a dark room. And the doctor that I used to go to gave me Imitrex for it. And it helped. Well, that tells me a whole lot of information that I didn't have before. So what have you done for these symptoms in the past? What has relieved it? Getting your issues addressed. Ask questions. I can't tell you how many times people walk out of my office with a pile of papers. I think I've done such a great job explaining it. They go 2 doors down to the health educator and they say, Marina spent all this time talking to me. I have no idea what she was talking about. Yeah. I really thought I was doing a great job. Sometimes it's a language issue because many of my patients speak Spanish and my Spanish isn't great. And sometimes I just didn't explain myself as well as I thought I did. If you don't understand something, ask. Because that's way better than coming back later, having taken your medication the wrong way, or having misinformation about what went on in the meeting. Know what tests you're getting and what they're for. I have folks who come out of a provider's office all the time and say, he's sending me for some x-ray. What x-ray? I don't know. What is it for? Some problem. Know why you're getting what test you're getting. Know how to take your medications, with or without food, or with or without, say, grapefruit juice. Grapefruit juice interferes with a lot of medications. That's important to know. What does only when needed mean? At the hour of sleep. If you work the night shift, what does that mean? That means at the hour of sleep, not at midnight when everyone else goes to sleep. What does twice a day mean? Take it every 12 hours or for lunch and dinner. Those are important things. Some pain medicines last 12 hours. You can only take them every 12 hours rather than with breakfast and dinner. Understand the side effects. If you get a new medication, ask what the side effects you can expect. For instance, niacin gives almost everybody flushing. If you take it and you get a hot flash and you know that that's normal, you're not going to be scared about it. But if you don't know what the side effects are going to be, side effects sometimes can be very scary. So in conclusion, be prepared. Keep a notebook. Plan ahead. Know what you want to talk about when you go in to see your provider. Get your issues addressed. A lot of times now, providers are very rushed to see a lot of patients, but that's your time. Make sure that you get your answers when you go to see your provider. Understand your medications. And if your doctor doesn't have the time to spell it out, you have a pharmacist that can help you, or possibly a nurse in your doctor's office. Understand your possible side effects and make the most of the time that you have with your medical provider. Thank you very much.